Hi everyone, I hope you guys are doing well. I'm here to present on melodic intonation therapy, which is also called MIT for short. And then throughout the video, I'm going to have little clips just like this one in the probably top corner, and you guys can just click on that for further descriptions of what's on the slides and further explanation. Alright, so what is MIT? MIT is an intervention method that is used to facilitate spoken language. So it facilitates spoken language through the use of exaggeration of pitch, tempo, and stress. So the main thing that MIT targets is the prosodic features of oral output. So in therapy, you're using different prosodic features that will facilitate oral output in the long run, so that eventually they'll be able to do the oral output without using the exaggerated prosodic features. So who should you use MIT for? So it's intended for patients with severely limited oral output, especially patients with Broca's aphasia. You want to keep in mind though that you want to have patients that have intact auditory comprehension to do this therapy with, and you also want to make sure your participants are willing to participate, because this could be kind of an uncomfortable therapy since you are like singing in a way. So is MIT restorative or compensatory? Personally, I think it could be both, but mainly restorative, because the goal is to foster brain changes and enhance prosodic features and speech output. But I also think it could be compensatory, because if a person already has the language, like it wasn't affected in their brain injury or stroke, you can use those prosodic features to facilitate the speech they already have. So this is just kind of a visual of what MIT would look like. So you can see in each phrase, as the phrase gets longer, you can see the rising and falling intonation, and then you can also see the stress patterns and how they are over exaggerated during this therapy. Alright, so the first article that I found was titled "The Efficiency and Timing of Melodic Intonation Therapy in Subacute Aphasia." So the purpose of this study was aimed to prove three main points. First, what is the efficiency of MIT on overall language production? Second was, does the timing of MIT have an effect on the whole outcome? And third, what are potential factors that can influence MIT outcomes? So the sessions were very intense, and they were 5 hours a week for 6 weeks. There was a difference in timing of MIT to collect data for their second hypothesis. So this just meant that the treatment group received therapy for the first 6 weeks, and then once they were finished, the control group received therapy for the 6 weeks to see who had the better outcomes in reference to timing. So baselines were collected on all patients at the first session. After baselines were collected, Tier 2 of the study began. So this was where the patients in the experimental group received that therapy I was talking about first for 5 hours for 6 weeks. The control group during this time received their typical speech therapy for the duration of this time period. After the 6 weeks, like I mentioned before, the control group received the therapy. And this therapy consisted of singing short utterances together while tapping their hand to the rhythm and slowly fading out those tapping cues, and the SLP also intoning those sentences. Homework was given to both the control and the MIT groups to ensure therapy intensity. Following the first MIT group's therapy, final baselines were taken using a variety of assessments. So the results showed that the authors found intensive MIT is effective and plays a role in outcomes in patients with severe non-fluent aphasia. The researchers also found that the earlier the MIT is given, the better the results will be in the end. So the second article me and my partner found, we shared this article, was titled The Effects of Modified Melodic Intonation Therapy on Non-Fluent Aphasia, and this was a pilot study. So the purpose of this article was to see if one session would show change in scores when compared to the baseline. And then their second goal in the study was to see if MIT would show positive scores in compared to the pretest over multiple sessions. So they were comparing if one session would make a difference, and then they were seeing if multiple sessions would make a difference as well. So the sessions were 10 to 15 minute sessions that targeted repetition and responsiveness using MMIT, which is just modified melodic intonation therapy. So the repetition test contained 3 statements. I need a drink of water, hello, my name is, and I have to go to the bathroom. So these were the sentences that they would intone using the melodic intonation. The responsiveness test consisted of 3 questions that they would have to then respond to. So the first question was, when you are thirsty and need a drink of water, what do you say to the nurse when she comes in? The second question they would respond to is, if I come in and introduce myself, hello, my name is, how do you introduce yourself? And lastly, if you're sitting here and you realize you need to go to the bathroom, or what do you say when you press the call button? So the results in this study showed that there was a significant change from pre to post test after only 1 session, which proved their first hypothesis. Over multiple sessions, responsiveness and repetition improved, even though repetition did not have a statistical significance. It still showed improvements, so this partially proved their second hypothesis. All right, so this was my partner's article, and it's titled From Singing to Speaking, Why Singing May Lead to Recovery of Expressive Language Function in Patients with Broca's Aphasia. So the purpose of this study was to determine if the author's previous study that evaluated MIT on patients with subacute aphasia would also work on patients with chronic aphasia. So the previous study found that improvements in repetition and verbal communication with the patients with subacute aphasia. So these sessions in this study were intensive sessions of 5 hours a week for 6 weeks. MIT also increased in difficulty throughout the progression of the treatment. So this therapy kind of looked like the patients would produce the melodically intoned utterances with the SLP while tapping the rhythm of the utterance. Then the SLT or SLP would give less support and the intoned pattern changed to the normal prosody. Finally, the patients would independently speak the production of the target utterance. So you would see the intoned sing-songy pattern slowly decrease to a normal intoned phrase. So the results of this study found that the experimental group showed improvements in only repetition skills. The authors concluded that MIT, in contrast to the subacute aphasia done previously, has limited effects in patients with chronic non-fluent aphasia. All right, so I kind of thought about all 3 articles and made some bullet points for main takeaways that I took away from the articles. So from the first article, we talked about how the earlier you begin MIT, the better your outcomes will be. And then also, I'm pretty sure all 3 articles, the SLP and the client will tap the rhythm to the phrase, and that showed to be an effective cueing strategy. And then the last article I talked about suggested that MIT had better results on subacute aphasia compared to chronic aphasia. So this would be something you may want to keep in mind when deciding if you're going to use this therapy or not. And then another point that I found to be interesting was MIT showed improvements after only 1 session in one of the articles. I wanted to give a quick disclaimer before the role play video begins. Each clip will have the level and then the step that it's representing. And if at any time you have a client that is not doing the correct step or is having difficulty, you would want to restart at the beginning of that step until they're able to complete the step and then move on to the next step. All right, so I'm going to hum the phrase and then we're going to tap the phrase out together. So, All right, so now let's tap it together. All right, and now you're gonna hum, and we're both gonna tap. Ready? All right, let's hum and tap the phrase together again. All right, now I'm gonna say the phrase, and you're gonna tap for me. All right? I need help. I need help. All right, now why don't we do it together? I need help. I need help. I need help. I need help. All right, so now I'm going to say the sentence and you're going to tap to my rhythm, okay? I need help. I need help. All right, and now you continue to sing and I'm going to tap for you. Ready? I need help. I need help. All right, now I'm going to ask you a question and then you're going to respond with the intoned phrase we've been practicing, okay? What did you say? I need help. I need help. Good job. We're going to practice the same sentence again and then I'm going to slowly stop while you keep going, okay? Ready?
Yeah.
Let's go. I need help. I need help. I need help. Good. So we're going to do the sentence together again, and then we're going to take a pause, and then you're going to do it by yourself after that pause, okay? All right, ready? I need help. I need help. All right, now pause. Okay, now do it again. I need help. Good. Now I'm going to ask you a question that relates to what we've been saying in our sentence, and then you're going to respond with something relevant to what we're talking about, okay? So, what do you need? I need help with homework. Good job. All right, I'm going to intone and tap to the sentence, and you're going to listen twice, and then I'm going to have you intone the sentence. So I'm going to do it first. I need help with homework. I need help with homework. All right, now you go. I need help with homework. One more. I need help with homework. Good job. All right, so I'm going to say the sentence 2 more times, and then we're going to take a pause like we did before, and then you're going to say the sentence twice again, okay? I need help with homework. I need help with homework. Okay, now let's take a 3-second pause. All right, now you go. I need help with homework. I need help with homework. Good job. All right, so now I'm going to say the sentence in normal speech, and then afterwards I'm going to have you try to say the sentence with normal speech, okay? I need help with homework. I need help with homework. Good job. Now I'm going to ask you a question, and then you're going to answer it with your normal speech, okay? What homework do you need help with?
Math homework.
All right.